And welcome everybody to our April, I feel like I always get the month wrong, April Comagine Health Patient Family Partnership Hub meeting. As you all know, these are the Zoom features. We have chat going, and feel free to add any questions or comments in the chat as you would like. You can also direct message folks if you have specific questions for people. We will have live transcript available. I don't see it on. Lindsay, are you able to do?
Yep, I got
it. Okay, cool. Thanks. I was lost. Thank you. We do have that live transcript or closed captioning available. You can click the little CC on your menu and turn that on. And then if you have any questions or comments during the discussions that you'd like to come off mute, you're more than welcome to raise your hand using the reactions button. We also have all these other reactions. If you want to celebrate or give a thumbs up or anything like that, you're more than welcome to use those during the meeting as well. And I'll go ahead and pass it to Katie.
Hi, everyone. This is the Comagine Health Mission. Together with our partners, we work to improve health and create a better healthcare system so that people and communities will flourish.
Thank you, Katie. Oh, my internet might be going out. All right, and so we are with PFCC Partners, and we are partnering with Comagine to bring you all this this Patient Family Partnership Hub. Our mission at PFCC Partners is to center the inclusive human experience of health, reinvent through radical collaboration, and be a catalyst for system transformation. Our vision is a health system transformed, one that works with people and through communities as a partner in their well-being. We do that through our values of equity, inclusion, diversity, collaboration, and being solution-focused. And like I mentioned, this is the Patient Family Partnership Hub. So there are existing PFACs within Comagine. A lot of you have been part of that either in the past or currently. And so this kind of encompasses all everyone in the Comagine Health system, all the patient family partners. Anyone is welcome to join us here in the hub. We have those engagement opportunities that we have a couple we'll talk about a little bit later in the meeting, PFCC events, community skills development, and those existing PFACs. These are our Partnership Hub meeting agreements we go through before each meeting. A couple of those are, we do open the meeting 10 minutes prior to start. So if you want to come on and chat, you are more than welcome to join us. I do provide context and discussion questions prior to the meeting. During a group discussion, participants will use the Zoom raise hand function if they would like to contribute. And if anything comes up during the meeting, please reach out to Comagine Health or PFCC Partners team member. So that's myself, Lindsay, Katie, or Savannah. And this is our agenda for today. We have Seema Rathore with us today. She's going to bring the topic of social isolation to you all, and we're going to brainstorm some solutions. And then we have our engagement opportunities. We have a team that came to us with the idea of a vaccine card, and they are curious if y'all are interested in that. And then the motivational interview webinar. So we'll do our welcome and our introductions. Let us know your name, where you're calling in from, and what are you doing for self-care this week. I can go ahead and start it off. I'm Laura Jackson. I am the Director of Community at PFCC Partners and located in Eugene, Oregon. And what I'm doing for self-care this week, actually, I feel like it's something people don't really share, but I did start therapy this week. So I feel like everyone should be out there. So that is what I am doing, and I'll go down my list over here. Thank you, Clarissa. Chris Severson.
Hey everybody, Chris Severson. I'm in Reno, Nevada. We actually have sun today, which is amusing. I went outside and went, ah! Some of you I know Lindsay knows, a couple of weeks ago, I did a grade 3 hamstring tear of my hamstring. And so if I'm sitting crooked, there's a reason because it still hurts to sit normally. And today I really didn't want to go to a doctor follow-up appointment, but I went and it was finally for the first time in 3 weeks. I felt like somebody could explain the whole thing to me. And I'm going to start physical therapy to help get it stronger. But I was in the hospital for 2 days. I've just, been thinking with it for 3 weeks now. And today I finally felt like somebody understood the whole picture. So I'm in a really good place today mentally because I feel like somebody now has a grasp on it. So anyway, so I'm taking care of myself and starting therapy.
Awesome. That is a great feeling. Thank you, Chris. Clarissa.
Hi, my name is Clarissa Hoover, and I just finished my little snacks, so I'll come on screen now. I am in Albuquerque, New Mexico, and I am starting a calorie counting app on my iPhone. So we're all kind of doing big things this week. It's hard to live up to, but yeah.
Yeah, lots of big things this week. Thank you. Thank you, Clarissa. Gotta stay healthy, mind and body. Donald.
You're muted.
Hi, I'm Donald Morgan. I'm from Hayden, Idaho. I go by Chris. And my self-help care this week is I'm finishing up physical therapy and going to try to go on my own. So after an extensive time. So
That's great.
thank you.
Thank you, Donald. Thanks for, or Chris, sorry. Thank you for joining us.
I answered either or. No, thank you.
Thank you. Let's see here. Jan?
Jan Lambert from Salt Lake City, Utah, where so far just in April, we've had 14 inches of snow in the valley. I don't know how many that translates to the mountains, but really a lot. And I'm coming off of my 3 weeks of self-care with a vacation. It's been wonderful. So I think I'm ready to get back to doing something more constructive than having fun.
Well, thank you. Thanks for joining us on the tail end of your vacation there. Thanks, Jan. Let's see. Joan?
Hi, I'm Joan Gallegos. I work for Utah's Comagine Health and work on their Patient and Family Advisory Council. Jan is correct. They've had a lot of snow in the valley. I live in a canyon, kind of in back of the university. I've had close to 6 feet of snow in the last week. So it is sunny today. I was out enjoying myself. I've been snowed in some of these days. The roads were terrible. We couldn't keep up with the snow that was coming down so rapidly. So my self-care is just getting out and enjoying the sunshine. I have 3 dogs. I can take them to the dog park and walk around. And I'm taking care of myself. I'm getting cataract surgery next week. Us Northern European stock be around a lot of glare all our lives. I grew up in Michigan with being on the lakes with the glare from the water, and then avid skier. So I've been around a lot of glare and I'm paying the price now.
Yeah, you don't think about that glare when it comes to all that. Thank you, Joan. I'm glad everyone's taking care of themselves. Lindsay.
Hi, everyone. I'm Lindsay Galley. I'm in Sacramento, California, and I'm just going to go along with this theme of Well, mine's not too big. I was telling Chris, we were kind of ruminating on our injuries. I have a weird sciatica hamstring thing going on, self-diagnosed sciatica issue. My mom sent me some exercises to do and stretches to do about a week ago, and I just did it today, and I like immediately feel better. So
Oh, awesome.
that's what I'm doing. I'm stretching.
Love it.
Feels
Love
good.
to
Yeah.
hear it. Thank you. Katie.
Hi, everyone. I'm Katie Frazier, and I am in Portland, Oregon. And I am on day 18 of going to the gym and going on a 45-minute walk. So they say it's 21 days to make a habit. So I'm really hoping that that's true because it's hard sometimes.
Yes, you're almost there. Just a few more days until it's a habit. Thank you, Katie. And Savannah?
Hi, I'm Savannah Smith. I am with Comagine Health and I live in Logan, Utah. And for self-care, I feel like I do it every day. I've been really into reading, so I'm just going to continue that. And also like being aware of when I am super tired and pregnant and asking for help from my husband so I can stay on the couch and, take care of myself that way.
Absolutely. Yeah, we all have to know when to ask for help. Thank you. And Seema?
Hello, everyone. Good afternoon. My name is Seema Rathore. I work from Portland, Oregon office, but currently I'm located in Austin, Texas. What I'm doing for self-care for this week? What am I doing? I am trying to go for long walks. I used to do that in Oregon. In Texas, this time of the year is kind of a little bit hard because you see the reptiles on the sidewalk. And I'm not a very friendly person in that way. So I will motivate myself to go more often.
Nice, nice. Love that. Love a good long walk. Thank you. Let me just make sure I got everybody. All right, I think I did. Oh yes, Chris, go ahead.
I would also like to say I just finished coming off a weekend with Comagine in Tukwila, Washington for the End Stage Renal Disease Network, where we had a group meeting and collaborated with the doctors and everything. So that was an excellent time and learned a lot of knowledge. So I'm still riding on that wave.
Awesome. That's really great.
Yeah,
I'm so glad.
Thank you.
Yeah, thank you. All right, and I will go ahead and keep it with Seema, who is going to talk to us about social isolation. And I will go ahead and stop sharing so you can share your screen.
Sorry, I was on mute.
Not a problem.
Okay. So, hello everyone again. I have spoken on this topic in past few meetings. Comagine, you all know, is a quality improvement, does quality improvement work, mostly works on Medicare contracts. The work I do is I try to, my work is related to reducing hospital utilization. What that means is reducing the avoidable hospital admissions, avoidable emergency department use. So for this, we work with hospital, we work with clinics, We are trying to work with communities on how to focus on transition of care, care coordination, and what else we need to so that patient is healthy in the community. What we learned so before I go into details, so here are the 3 things which we report monthly and then quarterly and also yearly to CMS. Like I mentioned, reduced emergency department visit, reduced hospital utilization, and then readmission. That's our focus. So for this work, we worked with hospital, clinic, communities. And what we learned from talking to hospitals are that there are obviously medical reasons that beneficiaries come to ER, which make which requires attention. But there are reasons where they come, which could where certain things could be resolved if a community is involved. So, for example, over and over, I heard that social isolation is it's one of the issue among elderlies. And I was talking to Laura about this yesterday, that we have heard that sometimes beneficiaries, they come to ER because they want to interact with the nurses, stay overnight, have some friendly meals, but they are okay as such. They don't have any medical issue. We have also learned that lack of connections with family is where they feel like, they are not feeling well and they need to go to hospital. Opioid overdose, depression, big food insecurities, and those are other things which we learned. We also learned from the hospital that to address social isolation, so you might know that if a hospital have a certain number of readmissions, then they have to pay penalty. So hospital also works to reduce the readmission. And certain hospitals which I work with, when they learn that their patients are coming to ER because of social isolation, what they started doing is that started hosting weekly lunch parties for beneficiaries so that they can come, have meal together, interact with staff and other beneficiaries. Some hospitals, I learned that they provide coupons for traveling locally. Community events are there which are happening in small communities, but we also learned that because the advertising is not heavy, not many beneficiaries, they know about the information. Other barriers are there that there are some events which are online via Zoom. Not many beneficiaries knows how to use Zoom or how to get access. So those were the barriers which we learned. So today here I am proposing to this team that we know that social isolation is a huge issue among elderlies. I won't say among elderlies, even younger population, but here we are discussing for elderlies. What can we do? How can we address? What kind of ideas you have? And I want this to be open discussion and open for advice, open for anything you have to propose here. And that's what I have, Laura.
Well, thank you, Seema. Thank you so much for sharing that and bringing it to the hub. I think it's it's a very important topic, and I think something that we can help you out with. So we would like to do a brainstorm of of some solutions or ideas you may all have around this issue of social isolation. And we want to do a little bit different of a brainstorm. And so what we're going to do is we're going to give you all, let's say, 3 minutes to kind of sit and think about what Seema just shared, write down your ideas and your thoughts or just anything. And then after that, we will come back and share what you all wrote down.
And Laura, I think there was a question from Joan in the chat, maybe before we get to that brainstorm, and I see Chris has her hand up.
Thank you. Thank you. Joan, so Seema, Joan asks, how big of a problem is this, people coming to the hospital ERs for social isolation?
Depending in communities, there are some rural communities which are very tightly knitted. There's a lot of support from churches. So those kind of communities, I hear that it's not as bad, but there are certain communities which we hear is quite bad. And it also depends on patient social economic status as well. So because I work with hospitals in Northwest, but I also have partners in East Coast, we hear all different kind of stories.
Do we have any hard data that say, it's 5% of admissions or 15% or what it is, so we can quantify, how big of issue this is in the grand scheme of things?
Yeah, so we don't have any hard data, but there is a lot of noise about this, and that's why CMS is considering to have like a billing code, like a code for social isolation. So I am not aware of data, but that's a good question, Joan, and I can do some research on if I can obtain any data and share with this group.
Thank
I had a
you.
quick question. Seema, do you have like a definition of what social isolation is? Is it being lonely? I'm
Yeah.
wondering if that's
Yeah.
kind of the.
So yes, that is a good question. And because CMS is coming up with billing code, so CMS will definitely have a lot more defined thing. But what we learned from social isolation is being lonely and various reasons, not able to drive, not able to communicate with family, and just losing that control of life.
Thank you.
Any other questions for Seema?
They're all good questions.
Yes, yes.
Yeah.
I'm sure we'll get more as we go on in our discussion as well. So we will give you all until well, it sounds silly to give you till 3:29. We'll give you till 3:30 or whatever time zone you're in, the half of the hour, to write down any of your ideas around this or thoughts, or if any questions pop up, of course, feel free to write that down, and we'll come back and share your thoughts and ideas.
Should we play some thinking music?
I know, I thought about that. Let me see if I can pull something up. Share some. Okay, is everybody ready? I'll take that as yes. All right. So who wants to go first? I think Lindsay. Go ahead, Jen.
Well, I thought of several ideas. We have a series of senior centers throughout Salt Lake City. And I think people should be made better aware of what those centers offer. I know they have lunch free if you can't afford it, or for a small price if you can, every day, Monday through Friday. They have different kinds of like low impact exercise classes for seniors. They have all kinds of events and it's all free. Now, I don't know about getting people there. I don't know, some senior centers may have vans even. I'm not too aware, but it's certainly worth looking into. And doctor's offices, if you know they took the time to find out the senior center closest to their patient, they could maybe even help them get hooked up with that resource. Also, I think there's a thing called adult daycare, right? Where people can actually go. Usually, I think it's for like memory care patients or people who need more care, but I know that that's very likely available. In Salt Lake City, there's a number, I can't remember if it's 211 or 611, that any senior can call for resources. Years and years ago, I did a booklet for seniors, and I'm not home, so I can't remember what that number was, but there is a number that seniors can call for help. So things like food insecurity, loneliness, and things like that. And then also, I was at a conference, and of course, I can't remember where it was, but it was about community nursing practice. It was in Washington, D.C. And during the pandemic, they actually were very active in working in the community in Washington, D.C. for those very things, food insecurity. So again, people could be referred to them. So it might be worth looking in to find out what they did, to find out what model they were using to do that.
Those are great thoughts. Thank you. I like utilizing the senior centers, and you know, there's always so many activities going on there. Thank you, Jan.
Can I ask a follow-up question, Laura?
Absolutely, yeah.
Yeah, so Jen, I learned that senior centers, so if senior centers are part of residential, then yes, they are being utilized. Otherwise, it's poorly utilized. Is that what you have experienced?
Well, no, the one that is closest to our neighborhood, for example, my husband goes and plays pinochle every Monday at the senior center. There's a track people can walk around. Again, they have these really low impact exercise classes where you sit and do things. They do little talks, and lectures, and the meals are very well attended. The lunches get lots of people there, so they are utilized, but it's open to everyone. And there's a library attached to the one we go to, also a city library, so you can actually go into the library. For those who are more active, they do pickleball, they have weight rooms, and for anybody who, like I said, can't afford it, it's free. If you can't afford it, then they ask you to pay, I think it's like $120 a year. But that you could actually, your Medicare will pay that for you. You get through Medicare, you get a benefit like for exercise or whatever healthy activities you want to use it for. And you have a card, so you could use that to pay for your health center, the senior center membership.
Great idea. Thank you, Jan. Chris.
Do you
Yeah,
want my list or, oh, which Chris? I'm sorry.
Oh, Chris Severson, you had your hand up. Go ahead.
Do you want my list or do you want just one idea?
We'll start with one and then go from there.
Okay. One of the things that I wrote down, first of all, the first thing I wrote down, Jan, was senior center. But the second was the reason for the isolation. And I think Seema talked a little bit about it. Some people want to be left alone. So maybe they seek out the healthcare when they don't want to be alone anymore. But I guess for me, it would be finding out why the person is so why they're isolated. So is it transportation, communication? I think it could be unique to the individual. And I think if you could find out what it is about that person, I think then you would, I guess what I'm saying is I think it's individualized.
Mhm.
So, find out what it is for that person and then figure out how to help that person. I don't know that we have one size fits all, and that it could be, transportation, it could be, I don't know, a number of things.
So Chris, can I ask you a question? Have you felt this kind of that your friends or family, do they feel like they are socially isolated or they're lonely or depressed? Have you felt like that, or do you feel they are very well connected?
Well, funny, I think when you raised the issue, we probably all thought of somebody that we know, at least I did. And I have somebody who I think is socially isolated, but I think for her, that's what she prefers. She reaches out when she feels the need to not be so isolated, but I think she wants to be left alone. So I don't know, does that answer your question?
And we have seen that in men, we see a lot more. We don't have any qualitative data, but this information based on quantitative on our interviews from various hospitals that social isolations they see more among men. So especially after they lose their spouse. So,
And the one I was thinking of was a woman, so it's kind of funny that you would say that.
yeah.
But
Yeah, so more data to come, but our information is based on certain hospitals we interviewed, so it could vary. Yeah.
Can I respond to that, Seema?
Sure, yeah.
Because that was one of the things that came to mind for me. I actually had a interlude where I was reviewing violent death reports, and so I read like hundreds of suicide reports, police, medical, everything, and it was really, there was like a certain kind of man who kind of kept on coming up, where it was somebody who maybe he had a job and nobody noticed he was missing until he missed work, or maybe he didn't have a job and nobody noticed he was missing until he didn't pay his rent. And then, these were suicides, so you know how that worked out. But I think it was very similar things, that they were so isolated. And so I've been kind of keeping my ears out for thinking about why that might be. And in some cases, and there were also signs of this that I didn't necessarily fully understand in the records, but that these were men who had a history of just bad relationships, that they had alienated their closest family. And it was almost like they just didn't want to risk doing it again. They didn't want to hurt anybody else. And they just thought of themselves as, not deserving any better or something like that. It's obviously really, really hard to tell when somebody's that isolated because they're not telling other people what's going on. But that was one of the things that came to mind to me, like Chris was saying, thinking about what are the root causes behind this. And what I was thinking about is like availability of behavioral health services, but it goes a little bit deeper than just general issues with behavioral health services. Is like, are these people who would feel welcome Or would they feel like they're the bad guy when they come into behavioral health? Or like, are there certain categories of people who are specifically falling through the cracks of like behavioral health even more so than a lot of us have already experienced? So that isn't necessarily a solution, but more of a avenue that needs to be pursued more in depth.
So I'll give you an example which one of my hospitals shared with me. There was this patient who was admitted, and after a few months, they tried to follow up. They couldn't get hold of the patient. And after several attempts, they sent the community health worker to their home. And the patient was at home. Home was not in a good condition. And when the social worker talked to the patient, obviously patient was feeling lonely, was not aware that patient can go to certain places to meet people or do certain things. And certain event had happened in last 1 year, which also obviously contributed to that situation. So I do agree there are several things, including from transportation to financial insecurity to a lot of different things. Yeah. This is a huge topic. This topic requires several of discussion, hours of discussion.
So I think that you just put out the idea of home visiting there in the case that you were describing, and I like that.
Yeah, so but the problem, Clarissa, is that since we are talking about problem, there are layers of problems. So for example, community health workers visits are not paid by Medicare, only Medicaid pays. So it's not like, they are employed everywhere. A lot of their work is grant-based. So if that grant is over, then they lose the community health worker or social worker. So what do you do in that situation? Like in Oregon, I know one of the hospital, one of their patient kept coming to hospital. After 3 or 4 visits, they involved community health worker, and they found out that patient didn't have AC. So just to fight the heat, he was coming to ER. So the staff, they raised the money to buy him air condition for his room. So unfortunately, there is no way to collect this kind of data for hospital. So that's why we don't have like a core data, but we do have a lot of qualitative information based on interviews. But this kind of things are not reported, so we don't have numbers like to share.
Thank you, Clarissa and Chris. Chris, Morgan, go ahead.
One thing I've kind of noticed in my community, so it's kind of an older retirement thing, but a lot of people are moving into our community from other states, is a lot of the older folks that I've been sort of deal with when it comes to reoccurring hospital visits. Some of them are the health conditions, and they're tired of going to the doctors, so it becomes a different issue as far as when the family calls in hospice kind of thing, because that can be a big issue. I mean, when you have we see somebody going back to the hospital every 2 weeks or whatever, it becomes a concern for the hospital, but also for the family, and being able to have people just to identify the situation like that, could even help with hospital revisitations, and that seems to be, that and financial situations, that dictates emergency room visits also. So I would just,
Yeah, that kind of goes back to figuring out the person's why they're feeling this way. And yeah, thank you. Thank you, Donald. Lindsay?
Yeah, so social connectivity is a social driver of health. And I know that CMS has had a big push for healthcare organizations to create SDOH screening programs that are effective. And so that's, I just wanted to add that because we have been working a lot in a separate contract on SDOH screening programs and encouraging hospitals who conduct those screenings to, work with patient family advisors just like this to hear their experiences of one, how to effectively screen, and then two, to ensure that they actually have connections to community resources and that those patients who screen positively get connected to the appropriate resources. So I think there's a big gap in those screening programs. So that could be a big area of focus because a lot of the things that have come up here, like transportation, food insecurity, it all falls under those social drivers of health. And I think looking at how organizations are screening and how they're connecting their patients with resources could potentially be a big gap.
Mm-hmm. Yeah, we
And
have all these resources. No, go ahead.
What
I was just saying we have all these resources and
exactly that are sometimes underutilized, also underfunded, which is a whole other thing. I was also thinking on the home visits. I don't know if this would work logistically because I understand the barriers, but say a hospital has a patient family advisory council. Can patient family advisors do home visits or just, go and sit on someone's front porch and have a conversation with them once a month or something like that? Is that something that we can encourage? I don't know. I was just trying to get creative to move around those barriers.
That's a good idea. Maybe I'll bring it to some of my hospitals to see what they think. They have a patient family council. So I'll definitely share that.
If they do, and if they don't, we know where to find us.
Yeah. We always say coffee is kind of the universal unifier, and just sit down and have some coffee with someone, I think could change somebody's life almost.
Sometimes for some patients, if that's all is needed.
That's all it is, yeah.
Go for walking. I see elderly people sitting on the bench alone. And sometimes when you talk to them, you do feel like, they are missing their family. And so now I make a special effort to just sit down for a few minutes and talk. And I have learned that I don't know how to define, but they do feel very isolated and lonely.
Yeah, absolutely. Joan?
Yeah, I want to share, kind of expand on what Jan said about the senior centers. And really, some of the most socially isolated seniors are those that are homebound. And many of the homebound don't have family or nearby friends. Sometimes their only contact is the Meals on Wheels driver that comes up and delivers the meal to them. And Deepthi Rajiv and I, probably about 5 years ago, actually researched this and applied for a grant where we were using the Meals on Wheels drivers. These are probably some of the people that really are in contact with these homebound to learn some basic screening, for instance, on suicide risk. But I think it could also be something you could, also, do some risk assessment with them, and it'd have to be brief, but where they refer in folks who they really see at risk. And again, these are your eyes and ears in the community for these really most at risk, socially isolated. We applied for the grant. We got a lot of support and interest from our Salt Lake Division of Aging and Adult Services with their Meals on Wheels and driver. We weren't funded, but we did a lot of research on just prevalence of the Meals on Wheels drivers, how we could use them in this capacity as the first line of screening for the social isolation, so that they would be able to refer in and really target some of these homebound that they can't get to the senior center. They're just not going to. And these are the people that really are most at risk for social isolation. Thank you.
Thank you, Jonah. I like that thought of utilizing those folks who are already boots on the ground, visiting people, or just trying to find those people who may already be visiting socially isolated folks and not necessarily using that to connect with them. Clarissa?
Sorry, I'm getting confused over my controls here. Well, I'm sorry, I didn't realize I was still unmuted. I was trying to re-unmute myself. I also was thinking about Meals on Wheels, as I said in the chat. I think that's hugely important. I remember my grandmother wasn't even necessarily homebound, but my parents went to visit her, and my dad said that the only sign of her eating food was cookies, like empty cookie containers, and like Meal on Wheels really made a difference in that situation. So speaking from the perspective of the people who are worrying but who aren't necessarily right there and able to help every day, the other thing that I was thinking about was and this would be like a very different population from what Joan was talking about, but our local community is pushing volunteerism with a volunteerism sort of matchmaking service or whatever, that people who want to volunteer but don't know where to go get in contact with places that need volunteers but don't know how to get them, that sort of thing. And for people who are still able to get to work. I think of that as maybe more of a prevention thing, that when people are in that sort of intermediate phase where they can get around, but maybe they aren't getting out as much as they can, it would give them something to do that would, and especially anything that brings elders together with children is so rich an experience for both.
Yeah, absolutely. Yeah, thank you, Clarissa. Especially if they can provide transport or a meal or something like that for folks who are volunteering. I like that matchmaking, so that they don't necessarily have to think about it. You get matched and you get to go do good work and connect with other folks.
That's a great add-on to that idea, Laura. I don't think they're actually doing that part here, but
yeah. All right. Well, thank you everybody for all these great ideas. I think Lindsay put the link for this Jamboard that we're showing here in the chat. So if anything else pops up in the next couple weeks or so, feel free to add to this Jamboard and we'll share it with Seema, and we'll share your ideas out. Thank you, everybody. And thank you, Seema. Okay. That's my scary desktop. Let's see. There we go. All right. So next we have, so like I said, the immunizations team, I believe, is interested in putting a vaccine card together. And they they think that I've got some notes over here. A physical vaccine card could be a useful tool for Medicare beneficiaries to track information about all of their adult vaccines. So they are curious, and I'm going to pull up, see if I can pull up in Zoom. I have a little poll here for you all.
Laura, could I interject something while you're looking?
Yes, please.
So, a couple of months ago, I got something from the New England Business Group on Health, or I think it's New England Business Group, which is one of my counterparts. And they had put together a sheet that had all of the immunizations that there are, and when you need them and who needs them. So like as a kid, or when you have kids, you know when your kids are due immunizations, but as an adult, I don't know that I always know. So if you were I'm just gonna throw this out there, but if you are going to use a vaccine card, you might want to couple it like on one side with what you should get every year, what you should get every 5 years, what you should get, so that you can know. Because like I said, I went through this whole list and there was like, do I still need to get an MMR? Do I need to get, seriously, I think we all know 10 years for a tetanus, but I just think that's helpful information. And I mean, I consider myself a pretty knowledgeable person, and I just lost complete track of adult immunizations.
Absolutely. I like that, having one side be kind of a timeline almost of when you should get what, and on the other side is or you can even stamp off those things as you get them. I like that. Thank you, Chris. Okay. And thanks for stalling for me as I pulled up as this poll. So the first question on here is, would you use a vaccine card if one was made available to you? Can you all see the poll there? Okay. And then the second question is, if you would use this tool, are you interested in helping the immunizations create such a thing? So I will give you all a few moments to answer that. And I see, Jan, you have your hand up.
Yeah, here in the state of Utah, whenever you receive a vaccination, like in a doctor's office, in the pharmacy, anywhere, it's reported back to the state, and you can go to the state health department and they will print you out a record of all the vaccines you've had. So like, for example, with COVID, they already know all the COVID shots I had and what the dates, what kind it was. And it goes back pretty far. They didn't keep track of them maybe 15, 20 years ago, but I think everything in the last 10, 12 years has been kept track of by the state. So it's actually very easy to obtain that here in Utah.
Great. Yeah. Thank you, Jan.
If I might add, just a resource for you, our Utah PFAC. Jan will remember and can elaborate on this, but we did a basic health history card that everyone could take to the doctor, that they could keep with them. And it did include vaccinations, but it also included past surgeries, medications they're on. So we looked at it a little bit more holistically, that patients needed to have, kind of a place where all of their health history was recorded. So when they're asked that at the doctor, they have it readily available. And I think Jan can comment.
Yeah, that's
well, yeah,
great.
I think you got it, Joan. We just wanted something we could carry in a wallet or in a purse, something small enough that you could do that. In case you needed to go, an emergency or anything, you had the information on who your doctor was, their phone number, medications you were on, any health issues that you have. And that came about because someone on our PFAC, their daughter, ended up in a hospital and they couldn't find her because of confidentiality. He would call the hospitals and they wouldn't tell them if she was even there or not. And so that kind of grew out of that, you know, person to be notified if you're in the hospital, those kinds of things.
Yeah. So it sounds like a vaccine card would be useful, is what it sounds like.
Well, it's especially useful for traveling, you know.
Yes.
Actually, not so much now, but you know, a year ago, you had to take your
Mhm.
COVID vaccine card with you. Also, often you have to prove if you've had the yellow fever vaccination, the tetanus or whatever for travel. But
Yeah. Yeah. And I like what Clarissa put in the chat, that she'd use it on if it was on her phone. Absolutely. You should see my COVID vaccine card is is not a pretty sight right now. So if it were on my phone, it would be ideal.
I was seriously tempted to go get mine, but I'll save that for when we're actually having these discussions.
yeah. Here in Utah, it is available. I mean, you can
Nice.
you can look it up on your phone and find out the vaccinations you have. Yeah.
Well, awesome. Well, great. I will take that back to the team and let them know that this is something that would be useful. And if anybody's interested in helping them create such a thing, please let me know. I'll put, just in case you don't have it, I'll put my email in the chat here, and feel free to reach out. And if you're interested in helping with that.
Or I let them know
You
that
know,
Okay. Chris is.
one thing I wanted to say, Laura, they should do just a little bit of research to see what exists, because we found that rather reinventing the wheel, there were actually forms out there that we could use and modify to make it look like we wanted to look. But rather than start from the scratch, they ought to see what's just kind of out there right now.
That's a great idea. Thank you, Jan. Okay, and I saw Chris was interested. Awesome. All right. I will move on though, because we are past time, and with another engagement opportunity. Again, the immunization team is holding a webinar session on how to use the presumptive approach or motivational interviewing. That is something we had talked about a little bit in the past. And in this webinar, they want to do kind of mock conversations on how to do that. And so they're looking for patient family partners who are interested in participating in those mock conversations as patient family partners in those conversations. So again, if you are interested, I see Clarissa's interested you're interested in the vaccine card one, Clarissa? Okay. If you are interested in this opportunity, feel free to reach out to me and we'll get you connected with that team. And of course, our PFCC conference is coming up in less than a month from now. We're really excited. May 2nd at the California Endowment Center in Los Angeles. We have I think a couple Comagine presentations coming to the conference. So we're really excited to see those of you who will be there in person, and we really look forward to it. Seema?
A quick request. Has anyone here experienced any positive, let me rephrase it. Has anyone here has any positive experience with community health workers? So we are doing a roundtable discussion on community health worker on a hospital discharge and how to get connected with community health worker. We were thinking to start the discussion with some positive story from the beneficiaries who have had some positive experience. So I don't know if someone wants to join the call for 2 to 3 minutes to share their stories or whatever time they want.
Yeah, I think Seema, that's great. If we could take that offline, we have the request form to complete and we'd be happy to
Sorry.
share
I'm
that.
so sorry about that.
No, all good.
That's okay. We are excited that you're excited about it. But yes, definitely send us that information. We'll get that out to the hub members and hopefully get some stories for you.
Laura,
Great.
can I add one more thing before we go?
Yeah.
So having had a recent hospitalization, and it's, it's been a while since I've actually stayed overnight, been in the hospital, but overall it was good. But I have a personal pet peeve about being called honey, dear sweetie, whatever. And it was rampant in the hospital, rampant. And I, other than tell them one at a time, please don't. I'm not. I just think it's unprofessional. And if anybody has any guidance or better ways that we can get that message out, and maybe it's just me, maybe it's just a personal pet peeve, but it was driving me crazy.
Yeah, Chris, I'd love to talk to you more about that offline, because in the past we've done some work around race, ethnicity, and language data collection, but not only that, sexual orientation and gender identity and how people want to be identified. And I think that goes hand in hand, like when you're going into the hospital, this is how I want to be identified, whether it's just my name, he, him, she, her, whatever it might be. So
Good point, Lindsay. I never
Yeah.
associated it with that
yeah,
effort.
yeah,
But
exactly.
you're right. It's
Mhm.
it's all, kind of one and the same.
Yeah, so if we
Yeah,
repurpose that, yeah.
I'm sensitive as a professional woman because in the
Mhm.
workplace, I was really adamant about it to, the people that I worked with, and they all knew, not to do it. But, when the mayor of the city of Sparks, when I was working there, he did it. And how do it's just, anyway. Thank you for letting me vent.
Yes.
Of course.
Lindsay, glad to help any way I can.
Okay.
All right. Well, thank you, everybody. My notebook is full now of great ideas. And like we said, we'll share that Jamboard out again. If anything comes up, if you think of anything about that social isolation, feel free to add it to that Jamboard. And thank you all. We will see you all next month.
Thanks, everybody.
Could Jan Lambert just hang on for 1 minute? Thanks, Jan. I just wanted to ask you about the conference. So I'll hold off till the other people leave.